Kia ora team, my name's Ben. Now let's have a look at our Ottawa Knee Rule and see how we can palpate the landmarks, and then we'll have a look at the sensitivity and specificity to see how good it is. So to start with, let's have a look at the rules themselves. So the indication for an X-ray following trauma in acute knee injury patients, we've got an age greater than 55, isolated tenderness of the patellar, tenderness at the head of our fibula, an inability to flex the knee to 90, and an inability to weight bear immediately, and an ED for 4 steps. Okay, let's bring up a knee. So the first thing we're palpating is for isolated tenderness around the patella. If we get rid of the skin and some muscle, the patella sits in the quadriceps tendon and it just floats right in there. So when we're palpating it, it's quite a freely moving bone if the leg is straight, and it's hard to miss. So through in here. The next landmark we're looking for is the head of the fibula. So now it's laterally. So the way to remember, fibular, la, little bone, la, laterally. And again, if we take off the skin, it's going to sit right here. So you can see the tendon of our lateral hamstring muscles comes down and inserts onto the head of the fibula. So if someone's knee is flexed, we can feel the lateral hamstring tendon and it'll come down and it'll guide us there. So just below the knee joint line. Those are the only two landmarks we're going to have to palpate for our Ottawa Knee Rules. So now if we look at a systematic review and meta-analysis, and if we have a look for the pooled sensitivity and specificity, then it comes back as 0.98, so 98% sensitivity and 43% specificity. Okay, what does that mean? So for the sensitivity at 98%, this means out of 100 patients who do have a knee fracture, 98% of them we will correctly test positive under our Ottawa Knee Rules, which means we only get 2% false negatives. So we miss a very small amount of fractures. So this is good. A negative result is highly reliable for ruling out a fracture. So if we remember our snout principle, sensitivity, if negative, then it's good to rule out the condition. With our specificity, it's at 43%. So out of 100 patients who don't have a fracture, only 43 will correctly be tested negative. That means we're going to get 57% false positives. So over half of our patients who don't have fractures will still be triggered to get an X-ray. So what this means is a positive result doesn't necessarily confirm a fracture, and many people who are going to meet the criteria won't have a fracture. And a thing like this, we want the results to be highly sensitized so that we don't miss things. So we're going to have to accept lower specificity to avoid missing injuries. Alright team, so our Ottawa Knee Rules are designed to help minimize the amount of fractures we missed, even if it's at the cost of doing a few more X-rays. Alright, happy studying!